The first question is, how has COVID-19 affected you, your family, and or your community?
So COVID-19 has affected us financially. It has affected the community financially. It has made me, I'm not complaining about it, but I used to work physically in my office, and now I work from home. So I could say mentally as well, because I don't get a lot of time face to face with people. So that affects me dramatically. Yes, I do have Zoom meetings and I am on calls, but I don't get the face to face interaction anymore, which kind of makes me a little bit sad. But on the positive side, I am able to be home with my son all day, and I've never missed a beat since he's been born. He was born during COVID in November of 2021. So during COVID, I was I had to get obviously vaccinated. I had him vaccinated in my belly. And right now we are just, taking the best precaution possible because my fiance, Edward, does have or had a heart condition before his heart transplant in May of this year, 2022. And so prior to, we had to make sure that he was safe, always masked, and it kind of made us lead a more careful lifestyle. In terms of the community, I just feel people are more reserved now. And they're obviously more cautious, but I just think people are more closed off now than they were before COVID. And I think that's about it. That's my answer.
Great. Thank you so much, Linda. Mm-hmm. Miggy, or Mom?
Oh, hi.
Hi.
Yeah, it affected our family, because now I have limit, to do what I like to do, and I stay home more longer, and I can go out, so like I used to. And I'm doing good because I had my vaccination before already, and I have, more opening to do whatever I would like to do. Mm-hmm.
Great. Thank you so much.
Yeah. So I think the biggest part for me was dealing with family that was impacted by COVID. So my sister had COVID and had a horrible time with it. She's has a lot of she has a compromised immune system. She's disabled, and so she was really very, very sick for about 4 weeks early on during the pandemic. And so not being able to see her, she's not able to communicate, was really just heavily sedated for 4 weeks, was very challenging. And, for my mom, we were not able to go into the city at all. Things were shut down. And so, it definitely took a toll from a stress perspective. I think, we are all, even today, I went out and I went to a store and I had my mask in my pocket because I kind of feel like, sometimes you have to be careful. I just learned of, somebody else who actually got COVID last week, and she had been wearing her mask. And then the one day she didn't wear her mask in the shopping center, she came back and she just felt terrible. And she's been vaccinated, so I think she'll make a full recovery, but it's still, not totally gone away. So it just makes you feel uneasy.
Yeah. And are you vaccinated, Miggy?
Fully vaccinated.
Okay.
Yeah.
Okay. Perfect.
When
So
I forgot to add that too. I am, my whole family is vaccinated as well. And we did catch COVID actually twice, all of us. My son caught COVID at 3 months old. And obviously he was vaccinated, like I said, in my belly. I've been vaccinated before. And then Edward was vaccinated, and we ended up with COVID just after Christmas in 2021 in January. Christmas 2021, after Christmas, we got COVID. So that was around January 2022. And then we got COVID again in July of 2022, which was actually post Edward's transplant. And then we needed to go for, he had to get an infusion, a COVID-19 infusion done, which is the procedure for somebody that's immunocompromised to that extent. But yeah, I also forgot to add that we were vaccinated and that we had COVID twice. Sorry.
no, that's fine. So what was your experience like getting the vaccine? From making the appointments to receiving it? Was it difficult to find a location? Was it, easy? What was your experience through the whole vaccination process?
Make an appointment, but last week when I went to the hospital because I have appointment for my heart, and the nurse told me take more precaution because the COVID is back, and they have a lot of people came to the hospital very, very sick, and they had no more bed in the hospital.
Was that just recent, or was that when COVID happened in 2020?
I went last week.
Oh, wow. Week. Okay.
Mm-hmm. That's in New York Hospital, Connor Medical Center.
Yeah.
The nurse told me they very, very sick people. They came to the hospital. Even children. Right. Mm-hmm.
Was it, so when you first got your vaccination, was it easy to find a place close by to get your vaccination?
Yes.
Yes.
No
Okay, good.
complaint.
Good. How about you, Maggie?
Yeah, I didn't have any issue. Like, I think early on when they first said you're going to get the vaccine, we were online searching for sites, but then it was fine. Like, we were able to log in. I was able to get it. Actually, at Keene University had a massive vaccination site. And so the minute you make your appointment, you go and, certainly it was kind of chaotic because, you had to go online, you had to find the place. But once you found the place, it was easy. It was pretty straightforward.
Yeah.
So,
and then how were the other vaccinations?
Available.
Okay.
Yeah.
Okay. So you found that process.
Yeah. I found the process very easy. No side effects or no drawbacks. Like, even for Jaden, I had him vaccinated and it was a piece of cake, actually.
Okay.
I would say the same. I do remember that in the very beginning, people were frustrated by trying to get in for vaccines. But I think that, like everything that's new, it's a slow rollout. So that, I guess that was anticipated. But at the time when I went to go make my appointments and appointments for Ed, everything was very easy to do. We just got ours done here in CVS at CVS in Summit. And one time when it wasn't available here in Summit, we did go to CVS in Chatham, which is not too far, but it might have caused an issue for someone in the community or, anywhere if they don't have a reliable source of transportation.
Right. So talk a little bit about your son's first vaccination while you were pregnant, right?
Yes. So I was honestly very hesitant to get the vaccine. I am not an anti-vaxxer by any means, but because this was something that caught all of us by surprise, and it just, kind of happened. I was a little bit skeptical because of the fact that I was pregnant. I would have taken it sooner if I wasn't pregnant, but because I was, and I was nervous about how it could affect my baby long term, I decided to hold off. I actually didn't get my first vaccine for COVID until I was 8 months pregnant. And when I was 8 months pregnant, I think it was like August of 2021. And so when that happened, what made me do that was because we were in the process of getting Ed on the list for a heart transplant, and we ended up seeing an infectious disease doctor who told us, and this was at Montefiore Hospital in the Bronx, and he told us, listen, COVID is very horrible. Obviously, with Edward's situation, we have to take precaution, and if he catches COVID, he could die. So with that, it was kind of like he kind of set me straight and made me realize, like, listen, I can't be selfish. And although, yes, I'm trying to protect the baby, we also need Edward around. And he said that ultimately it would protect all of us. And so with that, I was kind of more open to getting it. And I'd rather take the chances and have my family here than not. So I did it. But I will be honest and say I was very skeptical of how it could ultimately impact my baby long term. And he is fine. I thank goodness that we got it, the vaccines, because like I said, we did catch COVID twice. One was just not too long after he was born, in January of 2022. And, that was very scary for me. He actually was very symptomatic. I was in the hospital a number of times, but there's not much that they could do, for us. So they kind of walked us through, I guess, a procedure to use at home. But he ultimately recuperated and he's fine. And I think that truly, if he did not have the vaccine in my belly, he would not be here today, unfortunately. But fortunately, he is, because I did take that step, and I really do thank that doctor for definitely convincing me to do so, because it was really that bad. We were all hunkered down. We were all very, very, very sick.
Oh. All right. Thank you for sharing that. So what or who or where did you go for information about the COVID-19 vaccine, and what source did you find that was very trusting?
So I did a lot of research and read the newspaper and read, as many things as I could. And also I work for a company and where we have a chief medical officer. I work for a health insurance company, and we have a chief medical officer. And I was able to ask him a lot of questions. The other thing is, so my mom was very, very hesitant because it was new and everything else. And so I told her, I said, I knew I was going to go get the vaccine, but I asked her, let's go to your doctor. And her doctor was very clear in wanting her to get the vaccine. And so she was actually got the vaccine and was in the process of having an aortic valve replacement. So the doctor said, she has to have the vaccine, because once she has this aortic valve replacement, it's gonna make her immunocompromised, and we didn't want her to get sick. So, at the advice of the doctors, to me, your doctor should be one of your trusted advisors. And so I defer to my doctor, and I had her defer to her doctor. And they were very clear. And then, you read stuff, I was reading all kinds of stuff all over the place. So felt comfortable with it.
Good.
I feel more comfortable now because I could go, out, I could go to the store, and, and I still use my mask.
How did you find out about COVID?
¿Te va así?
Ajá.
No symptoms.
No, ¿cómo tú
I
te
found it.
enteraste de que había una vacuna?
Una vacuna, no,
Ajá.
como
En la noticia.
the news, yeah, the news. Mhm.
Did you find, was it like a doctor or the news or information on the
doctor.
computer that you felt very
The doctor.
trustworthy? The doctor?
The doctor, yes.
Yeah.
Dr. Kim.
Dr.
Yeah.
Kim. Mhm.
Yeah. Yeah.
Mhm.
Good.
About a month ago, I put the number 4.
Mhm.
Mhm. Vaccine. Yeah.
Very good.
And then for me, I found out about it. It was everywhere. I mean, it was posted everywhere. It was on the news, social media. Obviously, my family received the vaccine before I did. Like my grandmother, who you're talking to, and my aunt, who you're talking to now. So I knew about it. But yeah, I found out through all platforms. I feel like it was the number one thing that was imprinted in everybody's head or plastered everywhere for the last 2 years.
Yeah.
So.
Yeah. I think you talked about this in one of the questions before, but the next question is talking about, and Miggy, you did too, are the vaccines available in our community, which I believe you all said that they were. But
Yes.
was it easy for other people in the community to get these vaccines? So, there were a lot of conversations about like where you can go. Do you feel that it was readily available to our whole community to get these vaccines?
So I think that for people who are connected to, the internet and maybe social media had better availability of information.
Yeah.
But I will tell you, there's a gentleman at the Prestige Diner, and he's not young guy, but he's gentleman who really didn't have access to getting the vaccine. And so I actually helped him. I got online, I got all his vitals, and got online one night at about 11 o'clock at night and started searching until I could find him a location to get his vaccine, his first vaccine. And he's English is not his first primary language, so he struggled a little bit, and I think maybe that's why he had a hard time. But I think that if you're internet savvy, you're great. But if you're older, like I did everything for my mom, right? Or Linda will do something for my mom. If you're older and not super connected, you're gonna have some challenges for sure.
Okay. Yeah. So, thank you for answering that. So what do you think that the state or local organizations can contribute so more people have confidence in and access to the vaccine? So what do you think that our state can do, or local organizations?
I mean, I think if you pair with your local departments of health, if you're partnering with local organizations like the YMCA, where you can easily distribute information, I think that would be a huge help, especially for our senior population or disabled population or our population that's immigrant and is not English is not their primary language. I think we could do a lot more to encourage vaccination through collaboration with those types of organizations. So, maybe having the Y, do some sort of, again, with the Department of Health or State Department of Health and local departments of health to push out information to anybody that's coming in. So if you got kids in daycare, maybe, sending a flyer home to the parent in multiple languages, or, things like that, having signage up at the Y, come and ask questions, and having somebody who can provide good information, I think would be a great thing.
Good. So you talked a little bit about how that we need to improve the communication, especially in the different languages for, so
Yeah.
you did not see much of that information available in other languages, especially in the beginning. Okay.
Correct.
Linda, how about
And so-
you? Oh, go
Yeah,
ahead,
so
Ziggy.
then what happens? Yeah, I'm sorry. What happens is that you'll get a lot of misinformation through social media. So, things like I had a woman in New York City tell me that she didn't want to get she didn't want to get the shot because she had heard on Facebook that the shot, once you have the shot, that you can paste your phone to your arm. A lot of misinformation, yeah. And it wasn't until I convinced her to go see her doctor, and then once she saw her doctor, she got the shot. So again, it's like we have to do so much to dispel all the stuff that's out there that's not correct. And
Yeah.
the only way you're going to do that is through local infusion of information.
Yeah.
Yeah. For me, I heard that the government was going to track you and put a chip in you through the COVID-19 vaccine. I heard that, especially for pregnant women, that we should be careful because your child might end up with autism as a side effect of the vaccine. There is a lot of misinformation out there that could scare people. I also think that although elected officials try to be on TV and say, I got vaccinated. Sometimes that actually discourages people because, it's almost like people know that these elected officials have to, say that in order to try to encourage the public. And so it kind of backfires because, I remember, I forgot what his name was, but he was at the time, Mayor de Blasio, or, like some of the other, like of New York, or, even the president or whatever, saying that, they got the vaccine. And then, a lot of the youth will look at that like, oh, well, they're just saying that, or maybe it's not real, or, of course they have to say that. And so I think that it would be helpful to be more informed about the vaccine by the community, because these are people that, obviously we would know, that we have close relations with, and that hopefully we can trust. I think that also a great thing that was done during COVID-19 was the setup of vaccination sites, like pop-up sites or vans, to give people access who might not have, maybe they can't afford a ride, or they have no way of getting to a particular location, or things of that nature. I think that if, let's say, a community center such as the Y was open to being or setting aside a room or something for a vaccination site, that could be even easier access for people. Maybe somewhere that's close to public transportation. I know both of the Ys in Berkeley Heights and in Summit are close to transportation. And just thinking about different avenues for people to be able to gain access. One, they would be more trusting of people within their community, people that have already gotten the vaccine that can share their experiences, and that they can see after some time are okay. Maybe for the people that are skeptical still, and two, to make it more readily available. And I'm not talking about appointment wise, but location wise, so that people can, gain easier access to the vaccine.
Great, thank you. So for Mom, what is the best way that they could improve for the communication to get this information out to you? How would you like the communication to be sent to you about the COVID or anything else that comes forward?
¿Cuál es la mejor manera de tú recibir la información?
By mail. Oh, yeah.
By mail or phone call? Okay.
Yeah.
Yeah.
Mhm.
Because you don't go on the computer much, right?
No.
No. Okay. What about on the TV? The
I
television?
listen.
Yeah, the television?
Yeah, I heard.
Yeah.
Mhm.
I think
There's a lot of
she
places
listens,
now.
but yeah, I was gonna say I think she listens, but like let's say if they're putting something up on the TV like 311, call 311 for information, I think something simple as that could be helpful. But if they're giving out a whole number, I mean, they're expecting an elderly person to be able to write these things down or memorize, right. Yeah, then that's a little bit more difficult. So somebody reaching out to an elderly person by phone is probably a lot better. And of course, mail, the snail mail, as they say. But yeah,
definitely. So, have you had the opportunity to talk to a healthcare profession about the COVID vaccine, which I think you all have? So, what was that conversation look like when you had that conversation with them? So I know, Linda, you were saying that because of Edward and the baby and stuff, you had a lot of in-depth conversations with your healthcare provider.
Yep.
Yeah.
So it was mainly just letting me know kind of what the situation is looking like currently. So at that time, COVID was still being tracked in numbers, and they were saying that, there's still a lot of patients getting sick and coming into the hospital, letting us know kind of what could transpire, which obviously ultimately was the potential for Edward to die, which we didn't want to risk. So he in a way kind of scared me into getting it, but it was more like he was being informative and professional. Just the way I took it was like, I need to get this done now. So I actually ended up leaving the hospital, and I swear I got the vaccine the very same day. It was about 6 p.m. that day. Around that time, I got the vaccine. But yeah, it was just letting us know exactly how it could harm us or our family, what it's doing to the community, and letting us know what ultimately how it could affect us, and anything that affects us obviously is something we want to avoid.
Right.
So
right.
Mm-hmm. Mom.
My doctor, he recommended to have the vaccine, because I have a mitral valve replaced twice, and he told me I have to take the vaccine.
Okay. Mm-hmm. So, and he told you to do all of the boosters after as well.
Yes.
Mm-hmm. Okay.
It's very important. Yes.
Yeah.
Same with you, Maggie?
Yeah, my primary care doctor, I went in for a physical, and the first thing he asked for was, have you had all of your are you up to date with your vaccines? And I said, yes.
Yeah.
And he, supported it and fully, encouraged it. Also the flu shot, which I haven't gotten, which I have to take, but he's fully supportive of the vaccine.
Great. So my last question is, do you think that all of the communities in New Jersey were given the equal access or information to the vaccine? If not, who do you feel was left out?
That's a great question. I don't know so much if anybody was left out, really. I think that it had such a devastating effect on all of the communities and all of the hospital systems that, people were just trying to scramble to get to get folks vaccinated. My mom, she lives in Plainfield, and I remember going to visit her, and on every other corner, there was either a testing site or they had scheduled like mobile vaccinations, because there's a primarily Latino or Spanish population there, and many of them do not speak English. And so there was a big push to get folks vaccinated, because they were ending up in the emergency rooms, or in some cases dying from COVID. So I don't know. I can't say, one community was left out or wasn't, because I don't have that level of detail, but
Yeah.
I know that when I drove around, like especially to see my mom or in Plainfield, that definitely there were vaccination stations there.
Great.
I don't know that there were any communities left out.
Oh, hold on.
Okay.
Grandma's talking.
Go ahead, Grandma.
In the community where I live in Plainfield, and this is a senior apartment, and the manager, she recommended, the residents to get the vaccine, and they're not supposed to come inside in the building with no mask. They have to wear the mask.
Okay.
Mhm.
So that was a
Yeah.
requirement in your building that everybody had to become
Yes.
vaccinated. Okay.
Mhm. And I never heard anybody had the COVID in where are they in the building.
Good.
I never heard.
Good. Good.
So as far as anybody being left out, I would say no, I don't think anybody was left out. And the reason why is because I don't know if you'll remember when everything obviously was shut down, everybody needed to stay inside. And at this time, this was like at the very start of everything, where everybody was informed about shutdowns and staying in. And with that being said, the streets were empty. There was nobody outside. And at that point, everybody, I feel like, had to have known what was happening. Yes, it could have been, there could have been miscommunications or some confusions, but I feel like at that point, everybody had to have known, because they couldn't even go into, people were afraid to open their stores. The supermarkets were shut down for some days. Like, everything was shut down for a couple of days until they figured out exactly what was happening and got a handle of the situation. So I don't necessarily believe everybody or anybody was left out. More so, just maybe not as they didn't have as easy of access to whether it would be information or the vaccine itself. And my second thing is, for anybody that is youth, specifically maybe anybody that's troubled youth, that spends a lot of time outside, or maybe is in a home where the parents aren't, as on top of them, maybe some of that youth could have been affected by not having the information needed, if they don't have a supportive home, or if that adult is not as responsible to relay the information and they're spending so much time outside. So an advocate that deals with youth and that makes an impact on youth, maybe would have transferred the information, and that's the only type of community or person that I could think of that maybe the information wasn't relayed to them. I know that some people that I know personally, they might have not found out until later, or they might have been skeptical, obviously, because of all of the misconceptions and rumors flying around about the vaccine and what's to happen if you get it, what happens if you don't get it, So, yeah, I would just say maybe anybody that's a youth that spends the majority of their time outside.
Okay.
And that's it.
Yeah. Thank you. So is there anything else that you want to share that wasn't asked that you want the Department of Health to know about the whole COVID experience?
I would say that, yeah, I would say that it's not over. And I kind of feel like we're letting our guard down. We're sort of kind of like easing things up. And just this morning, I saw on the news that last week there were 4,500 deaths due to a combination of COVID, RSV,
And the flu.
and the flu.
Mm-hmm.
And that's and they said there are hospital systems that are overwhelmed and over capacity. And so the fear is that we're going to go back. In fact, I think it's Los Angeles is thinking about having implementing an indoor COVID mask mandate. And so part of that is we need to continue to communicate and really say to people, it's over, but it's not really over.
Yeah. Because you're adding
there's a word for it. They're saying it's not. Well, they were calling it an endemic, but now they're saying there's a triple tridemic or something. Yeah,
yes,
right.
Triple demic.
Well, they were people that thought it was over. They were calling it an endemic, but now they're saying it's like a tridemic or a triple demic or something like that. But I actually just saw something on the news as well last week, which made me tell Edward that he needs to ask if he can have his first vaccine post heart transplant from his coordinator, because obviously if it's not over and he's severely immunocompromised, I mean, he takes medication that literally if he doesn't have, he'll die. So I just worry, but we don't want to jump to get the vaccine and then have it obviously affect him negatively without getting permission. So we're waiting to hear back from that. I also need to schedule my 4th vaccine. And I am taking Leo to get his vaccine as well. I have an appointment on Thursday for him because he just turned a year old. And obviously they just rolled out for children the vaccine. So we will be getting that done. But I am definitely terrified if there is to be another pandemic or a worse strain, God forbid, of COVID. I agree that we should not let our guard down, and I think that also, let me just say that I feel like because this has been talked about so much and people have seen things get better. Yes, they have let their guard down, but because it's been so talked about, I think that in the future, unless something huge happens, like again, a mass number of deaths, I don't know how seriously people will take it anymore now that they know that with a vaccine, we can be okay.
Yeah.
A vaccine doesn't mean that you will be okay. I mean, we've gotten it twice with our vaccines. So it's just scary to think that people will say, oh, well, they're talking about COVID-19 on the news again, whatever, we've got the vaccine, we're okay. It shouldn't be that way because obviously history has the ability to repeat itself.
Yeah. Mm-hmm. Well, thank you.
And that's it.
Thank you for spending time with me to talk about this important topic.